ClassifyMyMeds, predicting prior authorization, approval, and volume. When a doctor decides a course of treatment for their patient, they will send a prescription to the pharmacy. The pharmacy will then contact the patient's insurance to find out if that drug is covered. If the drug is not covered, then a prior authorization is needed. Doctors will submit the prior authorization, which contains information such as diagnosis, whether other drugs have been tried, and contraindications. Insurance will then decide whether to approve or deny the prior authorization. Here's where Team Ruby can help. We can predict whether a prior authorization will be classified as approved or denied, saving both patients and doctors time and improving quick access to healthcare. We can also forecast future prior authorization volume at both the monthly and daily level, helping to predict revenue for healthcare technology companies. The data set we're using comes from the company CoverMyMeds. It contains over 1 million pharmacy claims records, each indicating whether the pharmacy filled the prescription, needed a PA, and if that PA was approved.
We predict the success of prior authorization based on drug, payer, and patient information. The baseline model here, which always predict one, has high accuracy. Then what really makes a good model? We want high true positive rate and high true negative rate, which leads us to consider ROC AUC score. Here we showcase 5 different classification models, all optimized on features and parameters of each, to get the best ROC AUC score. Turns out that the fine-tuned logistic regression has highest ROC AUC score, but it is not higher than that of decision tree and random forest here. But if you look at the F1 score, it is actually lower than decision tree and random forest, and even lower than that of the baseline model. Based on the statistics, we decide to go with either decision tree or random forest instead of the logistic regression.
So how confident are we about these estimates? We address this question by using bootstrapping to build confidence intervals around these scores. The middle of the confidence interval is depicted on this graph by a dot, with the endpoints depicted as the bars. If we look at random forest and decision trees, we see that the ROC score is high with a heavy left tail, and the other 2 scores are high with a heavy right tail. Logistic regression also scores well, but because its accuracy is the same as that of the baseline model, we reject this model. Therefore, random forest and decision trees are the best according to this graph. Finally, the drop feature and permutation importance scores for the decision tree have a higher standard deviation than those for the random forest, leading us to conclude a random forest model is the best to predict prior authorization classification.
We built an app using the random forest classifier. User can input their information using this simple form here. When they click the check button, the result will show them whether or not they need to file a PA and what's the chance of getting the PA approved.
We also forecast future PA volume at the monthly level for 6 months. We tested several different models and concluded that an additive exponential smoothing model gives us the best results. We use simulations to construct a 95% prediction interval around our forecast, and this prediction interval tells us that there is a 95% chance that our forecast will be within 5% of the true number of PAs filed monthly.
And using different methods, we can also make predictions of daily PA volume. The 2 methods we use are random forest regression and LSTM model. We make predictions for the year 2019 with data from 2017 and 2018. So let me describe our approach with a random forest regressor first. Since we had many features related to dates, we used a random forest regressor to predict daily volume from these features. But because these features don't account for differences between years, we had to normalize by the total PA volume of each year. And with this, we obtain an accuracy of 95%. With regards to the LSTM model, we used epoch number of 40, 0 dropout rate, and 28 days of loopback. And we obtain slightly less accuracy of 91%, but notice that this approach does not require prior knowledge of total PA volume for the year. As a recap of our representation, our team could predict whether a PA will get approved with almost 80% accuracy. This knowledge will improve speed to treatment and reduce prescription abandonment. We could also predict monthly and daily PA volume using different techniques, and this should certainly aid in budgeting and resource allocation. And thank you for your attention, and please don't forget to check out our app.